Hello, and thank you for joining today's webinar. We are ready to begin. Today's webinar is eligible for one contact hour. Sigma Theta Tau International Honor Society of Nursing, or SIGMA, is accredited as a provider of nursing continuing professional development by the American Nurses Credentialing Center's Commission on Accreditation. No one in control of the content today have any relevant financial relationships with ineligible companies. To receive contact hours for this NCPD session, participants are required to attend the webinar and log into our learning management system to complete an evaluation form. Information on how to access this will be emailed to all attendees approximately 1 week after the webinar. This webinar is being recorded and will be available via the Sigma repository in approximately 1 week. Following the presentation, if we have time, we will have a question and answer session. You'll see on your Zoom webinar control panel that you can send a message through the Q&A feature. This is where you can type in any question you'd like to pose to the presenter. Be sure to hit send so that the message makes it to us. Please use the Q&A for questions and the chat feature to interact with other participants. This webinar is proudly sponsored by InterStaff, Leading with Care. Please view this brief video from our sponsor.
InterStaff is an international nurse staffing agency focused on a nurse-first approach. Since 1998, we've used our decades of experience and evidence-based support programs to deliver impactful results for hospitals and the patients they serve. We recruit skilled nurses from over 50 countries, all eager to practice in the U.S. As one of the longest-standing agencies, we efficiently manage immigration, licensure, and relocation processes, making it seamless for hospitals. Long-term nurse success is at our core. Our holistic support and customized onboarding ensure smooth transitions, enhancing nurse retention and successful integration into hospital teams. In today's nursing shortage, InterStaff's international nurses provide a stable, cost-effective staffing solution, reducing reliance on domestic travelers while meeting both short and long-term staffing needs. We help hospitals build a sustainable workforce by attracting experienced nurses from across the globe. We're passionate about international nursing, leading with care, changing lives, and helping hospitals thrive. For more information, follow us on social media or visit us at www.interstaffinc.com. InterStaff.
Now, we would like to thank our speaker for sharing their expertise with us today. Of note, thoughts and views expressed are that of the presenter and do not necessarily reflect that of Sigma. Our presenter today is Alvin Mathiam. Alvin is an award-winning nurse leader with 28 years of diverse clinical and leadership experience in acute care hospitals in the U.S. He pioneered his organization's system-wide international nurse hiring program. As a leader, he is passionate about creating work environments where nurses succeed and become a great place to work. He enjoys coaching, mentoring, and celebrating his team's and colleagues' accomplishments. Please welcome Alvin.
Hi, good morning, everyone. How are you? And I see a lot of enthusiasm in our group today. A lot of people from the United States. I see people from Puerto Rico, UAE, Nigeria. Where else here? Indiana, New York City. Wow, amazing. Really, really happy to be here today and share my knowledge about international hiring and what we need to know as leaders and what we need to know as nurses to shape the future of nursing. Next slide, please. So today we're going to be learning three main things. So first, we will review some foundational knowledge of international nurse staffing and its vital role in U.S. hospitals, how international nurse hiring came to be. Two, to explore different strategies of international nurse integration, building workforce diversity, fostering inclusion, addressing turnover, and sustaining long-term staffing stability. And lastly, recognize the contributions of international nurses in fostering a diverse, collaborative, healthy, and supportive work environment. Next slide, please. So how did it all start? In 1898, the Philippines became a United States Commonwealth. During that time, around 1900s, westernized nursing schools were and medical systems were established in the Philippines. Because as you know, as a Commonwealth, there were a lot of American influences in that country. And so in 1948, the visitor exchange program was officially initiated. Along with that came like different challenges as to how nurses obtained employment in the United States after being considered visitors. So there, in 1965, the Immigration and Nationality Act was passed, and so that provided an opportunity for the nurses to live, learn, and work in the United States. In 1967, there was a lot of strain in operations in U.S. medical health systems, so there was more need to hire nurses. In 1970, officially the H-1A visa was approved to increase nursing pipeline to the USA. So this was the time where a lot of nurses from different countries were able to work in the United States to start a career. In the 1980s, we all know of the HIV/AIDS pandemic, and so the international nurses were instrumental in filling the staffing needs of various hospitals and healthcare facilities in the United States. And in the 1990s and 2000s, that's where really the international nurse recruitment continued. I was one of those nurses who were recruited in the US. So I came here because of the great need for nurses to work in hospitals and long-term care facilities. And we all know about the COVID pandemic, which was really, the highlight of, our generation when we experienced a lot of difficulties, especially with staffing. You can see in the slide right here, this is an old advertisement of Michael Reese Hospital in the Midwest, where they had a need for nurses. And also those are the different hospitals that were established in the Philippines during that time as, a strategy for, our from our American forefathers to really establish a partnership between the United States and the Philippines. So that paved the way for a lot of learning and growing for Filipino nurses and also for American nurses to learn about the healthcare system in the Philippines and be able to share that knowledge and expertise. So what is international nurse staffing and its vital role in U.S. hospitals? The population in the United States is really aging. In the 2020 United States Census, 1 in 6 people were aged 65 and older. So that reflects an increase of 50.9 million people with a growth rate of over 1,000%. As of 2020, there were about 500,000 immigrant nurses in the US, and this accounts for about 1 in 6 nurses, comprising the 3.2 million, estimated 3.2 million nurses in the United States right now. The American Hospital Association also published data about the hiring of international nurses, which doubled from 2010 to 2022. And we know what happened from 2020 to 2022, right? So, the COVID pandemic really expanded a lot of our, hiring needs and staffing needs. The HRSA also projected the demand for nurses to continue to increase until year 2037. So a lot of the factors also that contributed to international nurse staffing and hiring of international nurses is, the retirement of experienced nurses. Yes, we do have a strong workforce in terms of, hiring new grads, but what we needed in the past and in the present are experienced nurses, which, we value their knowledge and expertise, and also that is helping our nurses learn and grow from the experienced nurses. Staffing shortages and burnout during the pandemic also contributed to hiring more nurses in many U.S. hospitals. As the demand increased, there's also a high need for experienced nurses, especially in specialty practices like critical care, emergency departments, and operating room nursing. A lot of times, because of the increased need for staffing requirements, um, a lot of our schools, a lot of our hiring institutions and recruiters cannot fill the need for these increased staffing requirements. Also, let's not forget the insufficient number of nurse educators, faculty, classroom space, clinical sites, preceptors, and budget limitations, which impact the need to have a diversified staffing plan and hiring practices. So immigrant nurses also fill the staffing gaps in a lot of our facilities, especially in rural areas or states where there are higher vacancies. The presence of international nurses reduced the reliance on temporary nurses or travelers. So I remember during the COVID pandemic, I hired 40 travelers to immediately fill the need for critical care nurses. And so it was very expensive and also very hard in terms of operations because I needed to make sure that those nurses, travelers are proficient in the care of our patients. And it came with a cost. It's very, very expensive to have mainly travelers staffing your department. So to reduce the reliance on that, I strategized with my leadership to have different staffing approaches, and one of them is international nurse hiring. We also needed an adaptable and skilled workforce that would cope with current and future demands. So we saw that the importance of hiring international nurses because they also bring a lot of different experiences which could immediately fill the staffing gaps in many of our departments, especially critical care, progressive care units, even med-surg units, OR, and ED. According to the American Hospital Association, CNOs and administrators also saw the need to develop and sustain a diverse nursing and healthcare workforce. So a lot of our DEI initiatives came to be because of that vision. Next slide, please. So what is the value of international nurses in the U.S. healthcare system? These nurses really bring diversity from different countries. They share their experiences, which now teams appreciate. They bring nursing practices which we haven't considered before. So that really also enhances the culturally sensitive part of the care that we provide to our patients. Like here in the Metro DC area, we are a very diverse community. So providing care, culturally sensitive care is an important piece of that. So nurses that come here from different countries also contribute to the local community. They become leaders. They become professionals, healthcare professionals in our community where they're able to help staff different facilities in their local and regional areas. Their impact is also seen in the United States and in the global economy. A lot of times, international nurses, send money to the respective countries, so that helps increase the gross domestic product of those countries. And lastly, long-term staffing stability. As nurses acclimate and stay in the United States, they're able to build camaraderie and engagement amongst their teams. We've reduced our reliance on travelers, and at the same time, we promote the retention of our team members. So that's really an important part of hiring international nurses because a lot of times nurses have contracts, so they stay between 2 to 3 years. And in my case, my organization worked on getting 3-year contracts, so we're able to sustain our staffing because of that. And as the nurses acclimate, it's also an important part to know that they build friendships, they build community here, and now they love where they are, and so they really intend to stay for the long run here. Next slide, please. So this is my team. A lot of them are international nurses. 9 of them were successfully onboarded between 2021 to 2023. A good number of them are now preceptors, charge nurses, resource nurses. They brought a lot of diversity and so much perspective that my team and each one of us here have learned from. They have referred a lot of their friends and colleagues to the organization, so my success story also became an inspiration to the rest of my organization. We are a 5-system hospital, so uh, it became a system-wide initiative here. Next slide, please. So in strategizing and building a diverse and collaborative and engaged team, it is so important to understand implicit bias. A lot of organizations, especially the American Nurses Association, have released position statements on bias and discrimination, and it even became a magnet standard now, where organizations also need to have a process in place to address bias. So you might be curious, what is implicit bias? So implicit bias is a negative attitude against a specific social group, which one may not be aware of. So understanding your own bias is important to understand how you're perceived, and at the same time, building different strategies to integrate internationally educated nurses in your organization. So first is, understanding implicit bias. We have them. The good news is implicit bias can be unlearned. So how do we do that? Unlearning our biases starts with acknowledgement that, we have our own biases. Asking the questions of, do we have a preference for people who look like us? Do we hire nurses based on age or sex? Do you judge or make assumptions before you truly get to know a person? Lastly, do you accept or reject someone because they conform or disagree with your views? So really reflecting and looking at situations through the lens of our international hires who are also starting in their careers and in the organization is an important piece of building a diverse and collaborative team. Next slide, please. So there are 6 strategies to deconstruct implicit bias. One is replacing that stereotype, choosing the way you adjust your response to the new team member. So, everyone is different. Everyone has their own personalities and nuances. And so the way we interact with them impacts that experience. Countering the stereotype, pausing and reimagining the possibilities. So maybe you change your approach in every interaction that you have from every nurse. Individuation, seeing your new hire as a human being. They all want to succeed. They came here for a reason. They want to really take great care of patients and make you proud. So understanding where they're coming from is an important part of that. Taking perspective, placing yourself in their shoes, imagining what they might be experiencing. Coming here from another country and starting all over again it's a very, very challenging experience. That's one of the biggest things that I've learned, coming here from another country. It's hard. And so when you have a leader who supports you and helps you learn and grow, that builds you really trust, psychological safety, and engagement. Increasing opportunities for connections, spending time with them and getting to know them is important. I typically have my regular one-on-ones with my team. I dedicate a block of time in my schedule during the week to be able to get to know my team better and connect with them. So it's not only international nurses, but also, every team member. I have over 100, direct reports. And so it's important for me to build that connection and finding that opportunity to really get to know them at a personal level as well. Lastly, building partnerships is an important part as well. Working with them, embracing them as an integral part of your team. Next slide, please. So this is something that I learned from my mentor. She was the director of international nurse recruitment at one of the biggest hospitals in the state of Maryland. So she shared with me the handbook of for Filipino nurses immigrating to the United States. So this was put together by different subject matter experts in the lines of education, clinical practice, um, professional development, nursing operations. So it's a very diverse group of professionals who put this together to ensure that nurses are successful when they immigrate to the United States. So things that I learned are the stages of adaptation. As a leader, it's important to be able to learn about what nurses go through when they come here. It describes the different stages like the honeymoon stage, the shock stage, recovery, adaptation, and reverse culture shock. So nurses go through a lot of these different stages, and so it's not a linear way of saying, oh, they go through this, but really understanding that when nurses move to the United States to start their life, they may go through these stages. Sometimes it takes them quicker than others. And it's important to really pay attention to what they're going through and what strategies we can implement to support them. As nurses learn, grow, and adjust and adapt to our system, they also experience culture shock when they go back to their home countries because now they have embraced the new culture in the United States. But at the same time, they go back to their countries. Now they're not used to how things were. So cultural integration really is a form of cultural exchange where one group assumes beliefs, practices, and the rituals of another group without sacrificing the characteristics of their own culture. So it is a healthy way of intermingling beliefs and traditions with two different cultures. So the nurses learn from us here, and we learn from them. So all of that is really a form of exchange where that learning continues and grows as you build relationships. So for me, one of the most important things that I did, really learning about the stages of adaptation, and at the same time, setting clear expectations with them. Telling them about the education and competency requirements of the department, what skills are needed, and the behavior and professionalism that are expected of them as well. And having that continuous dialogue is an important part of their success. Next slide, please. So what are the potential challenges of international nurses? So with change comes different challenges. So they experience loss when they move to a new country, difference in values. So when you move from one country to another, those values change and your expectations also change because before you were very successful in your career no matter where you're from, but when you come to the United States, all those expectations really changes depending on where you are in your journey, and at the same time how you adapt in your work every day. Building of social skills, you got to make new friends now in wherever you are. So that's important part of being successful here is to be able to connect with different people. Also understanding your environment, whether at work or where you live, and building partnerships with different people. And lastly, for leaders as well, understanding bias. And nurses may also have their own bias. Like when they come here, they also learn new things. And so any preconceived notions of the United States or your coworkers may impact your success as well. So when nurses experience stress, they become homesick, they become lonely. These are some of the signs where, as nurses adapt, they also experience different ways of behaving and coping. Pain, difficulty concentrating, minor illnesses, work difficulties, feeling of constant pressure and tension. So If I notice somebody with these symptoms of stress, it's important to be able to leverage the support of your own team, and at the same time, wherever you work, I'm pretty sure you have processes in place to extend help to the nurses in the form of employee assistance programs, working with your HR business partner, connecting them to the community, connecting them to professional organizations are important parts of that. Next slide, please. So what does a successful cultural adaptation look like? So it involves successful acclimation to the work environment, So it's important for us leaders to encourage communication with your new team member, encouraging them to not be afraid to ask for help, to ask for questions. I remember when I onboarded my first few international nurses, I really had to seek the assistance of our professional practice colleagues. They were able to offer support by regularly checking in with the nurses and making sure we provide them with support and resources in the form of classes, additional simulations, and preceptor support. Social development is also an important part of adaptation where the nurses are connecting with their peers, engaging with their leader, building relationships in their community and professional organizations as well, making new friends and networking. So for my team members, I encourage them to attend, embassy events, joining meetup groups, identifying your passions, your hobbies, interests, and like for example, sports. And if they're religious, there are also different religious groups that offer services. Lastly, and most importantly, self-care and well-being. Understanding where they're coming from in terms of what they're passionate about, what brings them joy, and also looking at different opportunities to rest, relax, and recuperate, encouraging them to take time off is an important part of self-care and well-being. Reaching out for help is an important part of that, where here in our organization we have an employee assistance program and also mental health resources to be able to cope with stress and difficulties. Next slide, please. So cultural integration and engagement, I'm very happy to report that I think, we've welcomed international nurses in the organization for the past 3 to 4 years now. And we've come up with different initiatives to build on that. Part of an inclusive work culture is really understanding every team member's values, understanding what cultural holidays they celebrate or practice, or any personal beliefs that make them successful, accommodating them where possible, recognizing that each team member's past experiences really brings a new perspective to each team member. So in this picture, one of my international nurses arrived first. I think that this was in 2021. So I made sure I connected him with different groups within the area, and also, making sure that he's a part of the team. So now he's one of my very successful charge nurses here in the ICU, and very, very proud of him and his success. Next slide, please. Oh, sorry. One of the most important parts of strategies that I implemented is creating and sustaining a healthy work environment for the international nurses and my team as well. So years ago, I was in a doctoral program where I learned about healthy work environments. So learning the different perspectives of that from professional organizations like the American Association of Critical Care Nurses, American Nurses Association, subject matter experts like Cynthia Clark and Renee Thompson, where they really focus on how to create a work environment that helps nurses learn, grow, and succeed. So in my organization, we started the Healthy Workforce Initiative, where we sought the help of Dr. Renee Thompson. Thompson, she's an expert in healthy work culture. So during that time, one of the activities is creating a compact of professional behaviors, where every team member has an opportunity to really say, what does a healthy culture look like? So we had an activity where the team identified things that they want to see in the unit and things that they never want to experience. So everyone spoke. We included our physicians, our APPs, our social workers, our respiratory therapists, basically anybody that works with us very closely. Based on the data that they shared in the post-it notes, we collated that and we created our own compacted professional behaviors, defining who we are as our unit, our intent. So the team really is very proud of this. We describe ourselves as a learning environment. We're open-minded, we collaborate liberally, we identify gossip as corrosive, and we do everything possible to erode it to enhance the professionalism in our unit. Um, we put our commitment, our individual commitment, and really saying and stating, giving examples of what does an inclusive culture look like. What is a continuous learning environment where we really take responsibility that with the energy we bring to our work to make sure that we support each other. So in a healthy work environment, it's really the leader who sets the tone for the culture and direction of their units. And the team engages with their leader, bringing concerns forward, bringing recommendations forward to make sure that their voices are heard, and together working towards a common goal. That's really what I learned from this program, where we build our own culture and we build trust, relationships, and psychological safety. So this is my last slide. So what did I learn from this? A multi-pronged approach creates a domino effect, focusing on culture, effective communication, collaboration, diversity, inclusion and equity, safe and reliable staffing, accountability, patient care excellence, and team engagement. Everyone practices kindness in my department. We foster respect, we support each other, we help each other learn and grow. Everybody strives to continue to bring the unit to be a best place to work. And learning that the journey towards high reliability is a challenge, but this journey is not about perfection. It is about the relentless pursuit of excellence that keeps us going every day, reminding ourselves, why did we choose nursing as a career? So as a result of hiring international nurses, they brought a lot of amazing perspectives that we've learned and grown from. During the first year after welcoming international nurses and really focusing on our culture, our engagement scores rose to 92%. Our turnover was reduced initially during the pandemic times from 2020, 2021. I had 33% turnover. I'm not proud of that, but we employed different strategies to build on a really cohesive team, focusing on culture, engagement, and accountability. So now, our turnover here is low, below the national average. And overall in our campus, we have 13% turnover. And that really speaks to, the commitment of leaders to promote a healthy and positive practice environment. Our outcomes have also improved tremendously despite a very high case mix index. Our mortality is low compared to academic medical centers and magnet hospitals. We became an award-winning team last during the Nurse Excellence Awards during Nurses Week. We received the award for team collaboration, care innovations, and transformational leadership. Our programs have expanded, especially the cardiogenic shock program. Our ECMO program became platinum. and we received the Quality Award for Psychological Safety. So, these are the things that I wanted to share with you today because I know working in nursing and healthcare is challenging, but there are many, many different strategies that we can, implement. One of them is, bringing diversity to our teams and also celebrating our wins. That's important. So that's the end of my presentation. I would love to hear what your questions are. And I'm sure in our chat here, we have a few questions that are coming from nurses and leaders. And these are my references.
Thanks so much, Alvin. I want to just express gratitude for all of the great information that you've shared. We're grateful that you took the time to share with the audience and look forward to hearing more from you in the future. We do have a few questions that have come in, though. I'm going to start with, I'm just going to go through them as they have come in. So we'll start with this one. Could you please also address possible ethical issues associated with recruitment of international nurses?
Oh, that's a very, very good question. Actually, that's an important part of building a program. So luckily, we have resources like the Commission and Graduate of Foreign Nursing Schools. They have a division of the Alliance for Ethical International Recruitment Practices. So their goal is to really ensure that all international hires, any foreign educated healthcare professionals are recruited in a fair, ethical, and transparent manner when they're employed in the U.S. It's difficult in other countries, and I know when nurses come to the United States, we are also depleting some of their supply of experienced nurses, but that's a choice that the nurses make. Um, an important part of that is recognizing equity. So one of the things that we've done is to only work with recruitment firms that practices ethical recruitment and making sure that's in alignment with the practices that are um, the best practices of CGFNS and also the Alliance for Ethical Recruitment of Nurses.
Thank you for sharing that. Our next question, would an international NCLEX pave the way for an international compact like in some states?
Oh, that's a good question. I cannot answer that question because that's something that each state will have to work together. So here in the United States, we do have a compact license where, let's say you work in Florida, right? So if you live and work in Florida, you can practice in other states that are also members of that compact. So we are not there yet, but that's something maybe our legislators can address in the future. It's a complex process just by learning about nursing compact and how that works, but definitely something to look forward to maybe in the future where everything is centralized and nurses can practice everywhere. But to give you perspective, every country have their own standards and practices in terms of licensure, in terms of education, in terms of making sure that nurses are safe to practice. So that's the reason why in the United States we have our respective boards of nursing to be able to have a vetting process to make sure that every element of qualification is set before the nurse is able to practice as a registered nurse. But very good question.
Thank you. Our next question, this person wrote, first off, great presentation. And their question is, how would you encourage nurses from various continents to prepare to be recruited? What to have and how to engage with you all? And a second part to their question is also, what would you say to nurses from low-income nations? They cite various parts of Africa in their question that would like to pursue international travel nursing.
That's a very good question. So first, you have to have work experience in your respective countries. It's important to really build on that because coming to a country like the United States, it's very, very challenging. There's a lot of education and competency requirements. So being solid in your education and clinical practice first is important. So right after graduating from nursing school, make sure you have the work experience. So let's say first couple years you work in med surge, but your goal is to really work in critical care. So building on the knowledge, skills, and competencies to work as a critical care nurse takes years. So having that experience, work experience is important because a lot of recruitment firms, they would require you to be educated. Of course, you have your baccalaureate preparation, and then your work experience is typically 2 years is required, and then they're able to take you as an applicant. And also you have to be a U.S. licensed nurse. So right after you have work experience, and in the process of doing that, you can already start studying and preparing for the NCLEX RN. And then once you're licensed, you're able to apply and look for different positions, as most recruitment agencies also advertise. What was the second part of the question?
The second part of the question was specific to nurses from low-income nations looking to pursue international travel nursing.
Okay, that's a good question as well. So those I have nurses from Africa also. I have nurses from Ethiopia, Eritrea, and so what they've done is, they were very motivated. They focus on their education. They have different work experiences. Sometimes the United States is a destination, right? So they work in other countries like Saudi Arabia as well, and Asia. They work there and then they come here. Sometimes the path to success is not really direct, but taking steps on how to get work experience, focusing on that and your English language skills is important, and also connecting with people who can help you is very important. So while you're working in your respective countries, really building those relationships with your leaders as you build on your experience is important to be successful. Thank
Thanks,
you for that
Alvin.
question.
I want to remind folks that if you do have questions, please use the Q&A box as opposed to the chat box so that we can properly kind of queue them up for our presenter. Alvin, our next question is, do you have any recommendations for resources to share with international nurses on arrival to assist with cultural and professional acclimation?
Oh, nice. Very, very good question. So, a lot of hospitals have systems and processes in place to build on that. So, I can speak for my organization where, when the nurse first gets here, I connect with them. I connect them with support and resources within the hospital system, whether they would need HR support, education support, connecting them with professional organizations. So here we have the American Nurses Association, we have the American Association of Critical Care Nurses. There are different groups from different, countries as well. So I encourage them to reach out, make friends, build relationships and connections, identify what you're passionate about. Because maybe, you're religious and you want to go to a church and build community there. That's important because once you connect with people who also love what you do, that's great, right? So, but to do that, you have to step out of your comfort zone, and then you build relationships with people that you have similar interests. Like if you're interested in sports, or you like working out, you play basketball. That's part of really learning and growth, and acclimating to your new environment.
This next question is a little bit long, but is a great question that we've received. This person says, I am a bedside nurse and I've had the pleasure of orientating international nurses. The biggest challenge is using technology like Epic, and also there is a language barrier with patients. What resources can I access to help as I orientate team members outside of my current resources?
Thank you for that question. And first of all, thank you for orienting your new team member. Being a preceptor is challenging, but the sharing of knowledge and expertise is part of our professional responsibility. And so, I applaud you for doing that. So first, technology. Um, I'm certain that every organization have Epic resources. So in my case, I would send the nurses to Epic training. And at the same time, if they need a little bit more time, then I work with our IT and education department to have them, work or learn in a simulated environment. So if there is a computer lab in your organization, make sure you tap into those resources with IT and education and be in a simulated environment. So for example, if you want to do a complex assessment, you build on that by practicing in in that Epic environment where it's all fictitious patient information, and you build on those skills by practicing. Two, language is important also to be able to communicate. Part of being a nurse is communicating with physicians, communicating with patients, communicating with your leaders. So being comfortable in the English language is important. So practicing, that's also a big part of that, and speaking clearly, making sure that the other person understands you. One of the things that I did in the past was, I watch a lot of movies and TV, is sometimes you learn different cultural references and idiomatic expressions just by watching, and being interested in learning more is important, definitely. And of course, making friends, building those partnerships with your coworkers and your immediate community is an important part of your success. Yeah, somebody mentioned watching American TV shows and news. That's very, very good.
Thanks, Alvin. The next question begins by, again, thanking you for the rich and enlightening presentation. And their question is there any intervention to prepare patients/health service users who will be cared for by international nurses from diverse backgrounds?
That's a good question. Yes, definitely from that standpoint, you know, every organization have their diversity and inclusion statements, and here in the DC metro area, we're a very diverse community. And so an important part of that is number one, asking that question when, when you're going for your interview in the organization that you are potentially working for. What is their diversity statement and what interventions do they have to make sure that, patients and people that are in that immediate area understand that, this is a diverse work environment. And so you may see people that, come from different backgrounds. So that's a really good question for the leaders of that organization or department. So when you go for your interview, ask for that, because I can only speak for my practice and my organization and not for other institutions. So yeah, that's a good question to ask for them.
And we've got time for about two more questions.
Okay.
So the next question that I'll share is, how do you verify a nurse's work experience in a particular area?
Yeah, good question. So for us, and I can speak for myself, I do work with recruiters, and they make sure that they are proficient. I ask questions, and a lot of these questions are specific to the practice of critical care. I would know if the nurse has really worked on that experience, and also part of that is honesty and integrity, because if you're applying to work at in the United States, it's important to be able to say I have 4 years of let's say, emergency department experience, and be able to articulate your experience in that interview. Our profession is based on honesty and integrity, so it's important to really make sure that before you apply for that first job in the United States, that you actually took the time to learn about your practice wherever you may be in whatever practice setting or situation. So leaders would ask those questions, especially clinical care. They will ask about how they will ascertain how you communicate and what levels of expertise based on what they do. So I try to match the experience of the nurses to what we do here. So I ask them specific questions about devices that they've handled before, any advanced therapy modalities, those kind of things where without that level of experience, it's difficult to be able to acclimate successfully. So yeah, that's what I would do.
And our last question that we have time for today, do you have any tips on helping acclimate with the acuity of patients? The person specifically mentions time management skills and keeping up with the pace of United States hospitals.
Oh, very good question. As our population here in the United States continue to grow, a lot of people are retiring. It involves a lot of them, patients become sicker and sicker. I talked about the case mix index earlier in my presentation. So, understanding that now the patients here that we take care of is very, very sick, very complex. They require 2 to 3 different advanced therapy devices to be able to live. And preparing for that acuity, it takes time. And so I would highly encourage you to build on that experience. So if you're a newer nurse working in a med-surg unit, is good. And then if your goal is to, let's say, work in a critical care unit, so you need to find those hospitals that care for these type of patients. If you are intending to work in an operating room, working in a high acuity OR where they do transplants or open heart surgery. There are also nurses who want to go into emergency room nursing. So working in that specialty for a period of 2 to 3 years is important for you to set yourself up for success. For our part as leaders, when we hire nurses, we also look into building a structure around education and onboarding and orientation. So some of the nurses that I hired, they have medical and surgical experience and some cardiac. And so an important part of that is to bridging that gap of learning skills and competencies and making sure that the nurses are prepared to handle. So if you spent a good 2 to 3 years in your specialty, I wouldn't doubt that you will be successful because you took that time. You took initiative to really build on your skills, and having that mindset of being open to learn and grow, being open to feedback is an important part of growth, and applying everything that was suggested to you. So let's say your preceptor recommended that you do more advanced reading on the pulmonary system. So it's important to be able to learn that. And then the next time you work, show that you took the time to read, ask questions, and also take the feedback that was given to you.
Thank you so much for spending some time with us to answer those questions. Unfortunately, we did have some additional ones come in that were unable to be answered, but we've encouraged our listeners to connect with you on LinkedIn to continue the conversation. And so, again, just want to express, I know you can see the chat and all the comments around how much people appreciate your excellent and informative presentation. To our listeners, we hope you enjoyed this webinar. We have updated our process so webinar attendees can now access our learning management system to complete the evaluation and obtain your certificate right after the webinar. concludes. Please note you're not able to click the link on the screen, but we have shared the link in the chat for you as well. If you're not able to access the link, you can access the evaluation through Sigma's Learning Management System by searching for the title of the webinar. In addition, all attendees will also still receive an email within a week of this webinar, as well as with a link to access the evaluation. I want to note that this is the first webinar in the Navigating International Nursing Staffing webinar series, sponsored by InterStaff in conjunction with Sigma's upcoming Creating Healthy Work Environments event. Registration for this conference remains open, and we encourage you to scan the QR code on the screen to learn more. Thank you very much again.